My name is Julie Goddard, and I'm a head and neck surgical oncologist and microvascular reconstructive surgeon here at the University of Colorado, Department of Otolaryngology, Head and Neck Surgery. I'd like to provide you with a brief introduction and overview of our training program for the residents here. I started my career here at the University of Colorado in 2016 in head and neck surgery after doing residency at Baylor College of Medicine and fellowship at the University of Cincinnati. I was then on faculty for several years at University of California, Irvine, prior to coming here to Colorado. I was thrilled to be joined this year, 2022, by Dr. Cervenka. He came to us from University of Cincinnati, where he was serving on faculty after completing his fellowship at Vanderbilt University and a residency at University of California, Davis. I'll let Dr. Cervenka tell you a little bit more about himself.
So hi, my name is Brian Cervenka. I'm one of the head and neck oncologists, microvascular reconstructive surgeons here at the University of Colorado. I actually recently joined faculty here about 4 months ago, actually coming from University of Cincinnati, where I practiced for about 2.5 years after finishing my fellowship at Vanderbilt University. Just like Dr. Goddard, I have a pretty broad head and neck oncologic practice with a lot of mucosal malignancy, a lot of cutaneous malignancy, as well as I perform head and neck transoral robotic surgery as well here at Anschutz. In addition to that, a lot of microvascular reconstructive surgery, both here at Anschutz with Dr. Goddard, and then I spend some time also over at Denver Health with Dr. Groman, helping perform some of the complex reconstructions over there. I have a huge interest in teaching, and working with the resident team is one of the most, certainly the most rewarding and exciting parts of my day and my career. I'm extremely excited to meet everyone this year and meet the new potential team that will be coming out to join us. Never hesitate to reach out if there's ever any additional questions that we can answer. And I will say, I'm always very excited to have residents who are interested in head and neck or in microvascular work with us and start raising flaps and doing the microvascular and doing that work fairly early on. So very excited again to meet everyone, and best of luck on the interview trail. Take care.
Both Dr. Cervenka and I are primarily based here at University of Colorado Hospital, and our practices are very similar. We see the full gamut of head and neck surgery. We work closely and well together. Both of our practices include, of course, mucosal head and neck cancers, as well as cutaneous malignancies, head and neck endocrine surgery, open skull-based surgery, as well as microvascular free tissue transfer, the free flaps that you'll learn about. Both of us also spend time at other sites, including Denver Health and the Rocky Mountain Regional VA, primarily for free flap coverage and that portion of coverage for head and neck oncology. We're really fortunate to have a dedicated group of faculty here to train residents across all of our sites, and you will get head and neck oncologic surgery experience at every training site, including here at the University of Colorado Hospital, Denver Health, the Rocky Mountain Regional VA Medical Center, as well as Children's Hospital. I'd like to focus primarily on University of Colorado Hospital because my colleagues have given you some insight into the VA, as well as Denver Health and Children's Hospital in the other videos. We're also really fortunate to have in our practice advanced practice providers who are a key and critical part of our practice and also an enormous resource for you as residents. Jeannie Doyle is a physician assistant in our practice, and she's been here with CU head and neck surgery for a decade. She has extensive experience and also is extremely dedicated to education. Liz Quadrado is a speech-language pathologist that we recruited in 2017. She works with both our head and neck practice as well as our laryngologist, primarily focusing on swallowing in all patients, but also in alaryngeal communication for our laryngectomy population. Here at Anschutz campus, we're the 4 main providers for head and neck cancer surgery. We are to be joined soon by another physician assistant, Jordan Fisher, who will join us later in 2022 to work in our outpatient practice. I would also mention our colleagues and partners who provide head and neck cancer surgical care and education at other adult practice sites. Doctors Nathan Groman and Vincent Eusterman are both fellowship trained in head and neck oncologic surgery and practice at Denver Health. Dr. Brooke McConnell works full-time at Rocky Mountain Regional VA Medical Center and leads our head and neck cancer program there. In addition, a unique aspect of our program is that we have a full-time basic science and translational research faculty member dedicated to head and neck cancer research and is housed in the Department of Otolaryngology Head and Neck Surgery, Dr. Shilong Liu. His lab does work in signaling pathways, cancer stem cell and oral microbiome, and head and neck squamous cell carcinoma pathogenesis, and also work in identifying salivary biomarkers as well as novel therapeutics for head and neck squamous cell cancer. With the University of Colorado Cancer Center being the only NCI-designated comprehensive cancer center in Colorado and in a large portion of the surrounding region, we draw our patients from all over Colorado as well as surrounding states, including Wyoming, western Nebraska, western Kansas, northern New Mexico, and even southern Montana. During your residency here, you'll see the full breadth of head and neck oncology as well as different patient populations, and our residents exceed the required case numbers for head and neck surgery each year. We have an amazing group of collaborators here at University of Colorado, meeting in a weekly head and neck tumor board. We have 3 medical oncologists and 2 radiation oncologists whose practices are solely dedicated to treating head and neck cancer patients. We also collaborate with a group of cutaneous oncologists that has a separate tumor board that meets weekly to discuss melanomas as well as other advanced cutaneous malignancies. And monthly, we have a meeting with endocrinology as well as endocrine surgery colleagues to discuss difficult and challenging endocrine cases. We also work with a great group of surgeons from other departments, including vascular surgery, neurosurgery, oculoplastics, as well as the other surgeons in our department, such as our neurotologists, laryngologists, and facial plastic and reconstructive surgeons, with whom we're always planning combined cases. So as a resident here, you have the opportunity to be exposed to an enormous number of providers for research collaboration, discussion of career pathways, and all kinds of opportunities to learn from other specialties and people who have taken various pathways to get to where they are now. So I think here at University of Colorado, you have more than ample opportunity to get exposure to head and neck cancer to achieve whatever goals you wanted to in your career. In my past 6 years here, we have matched 3 residents into head and neck surgical oncology fellowships. And all of our graduates finish with an experience where they feel confident having head and neck oncology and head and neck surgery in their practice in whatever capacity they choose. We're excited to have you evaluate our residency program here, and I would say the things that I would highlight that are a little tougher for you to pick up if you're not having a face-to-face interview experience. But some of those things are the overall attitude and dedication of our faculty to the education of residents, as well as having an attitude of approachability from that standpoint. Also, I think the camaraderie here, of course we're biased and you'll hear this in a lot of different places, but from faculty to residents and in between, I do think there really is a genuine sense of camaraderie and wanting to make sure that everyone's succeeding on all fronts. And so while you may not be able to see that from videos, I will tell you that it is a real thing. Thanks so much for showing interest in our program. We hope to see you in interviews, even if it is just on a screen. And please let us know when you have questions.